we are, my clinic in Tijuana, Mexico. I'm here with
Angelica
and Roel.
So what part of the world did you guys come from?
I come from Austria.
And I originally come from the Netherlands, but live in Austria now.
Excellent. Okay, now, you came down here, and I know you didn't have any symptoms.
I had no symptoms.
No symptoms whatsoever. And you came down, what did you come down here for?
Mainly for my hip. I had some back pain, but mainly for my hip.
Okay, now one of the ways that we approach it, nobody is going to have hip pain, and 90% of the nerves coming off the spine, there's no pain fibers. So I'm fine. I don't have any symptoms. Okay. Okay. So we're not just treating your hip. We're looking at the whole body. What have you experienced so far?
Well, I can walk a lot better right now than I did before. I had a workout 2 days ago for the first time without any pain in years. Yes. So it was really a big improvement already after like 8-9 days.
Okay. 8-9 days, total change. And we also did post x-rays.
Yes.
Which now you should be happier because your husband is even better looking inside.
I keep him longer.
But you had no symptoms whatsoever. Please describe that because we were talking before.
Because my husband has been here for a week, and he said it was so amazing, so miraculous feeling and the treatment, and I should just come as well and just see what's going on with my body. And during the first interview, I'm saying, well, I don't have any symptoms. I don't know anything that I can really kind of list. But as soon as we went through the questionnaires, stuff popped up. Like I have regular migraines, and I chucked it up to allergies, thinking I have allergies to nuts. And it didn't always make sense, but I just held on to that belief until we realized through all the treatments and the adjustments that it was a severe blockage of my spinal fluid. You have to explain the actual thing that happened with fluid in the brain.
Okay, the cool thing, and this is what we look at with everybody. The brain is unique. It only weighs 2 pounds or a kilo, and it burns 90% of the body's oxygen. It does that by secreting its own food called cerebral spinal fluid. It produces it in the brain, and that fluid leaches down through the curve. But if you have a loss of curve forward head carriage, then pressure backs up. And we check everybody on this, what's called sagittal suture, because the coverings of the brain actually invaginate up through those sutures. And that's the cool thing. So before I adjust you guys, I'm checking, and there's a hot spot right in the middle, tender, and by the afternoon and the next day.
It was initially tender, almost like borderline painful. And I think 2 days later, or at least even like 1 day later, it was fine. And 2 days later, it's like not even there anymore.
I know, it's cool. Yeah. And we got some people that can't even brush their hair because it hurts. And that all it comes from intracranial pressure inside of the skull that's elevated. And that negatively affects the whole system.
And I also have to say that my head was tilting forward by massive 2 inches. That's a big tilt, and doesn't make for good posture.
But you guys are choosing something totally different. In our culture, it's usually a pain here, injection, drug, or something. But you're not doing that.
I didn't like the options.
I know. Did you guys have like really smart grandmas?
The only option that was given was getting a new hip. And I kind of like my hip.
Yeah.
So if nothing else happens, I might consider it. But I would have to really know for sure there's no other options. Yeah.
And now, do you think that you're ever going to get a fake hip?
No.
I know, never. It's so cool because the body, it regenerates itself. I mean, so somebody you're feeling completely different, even though you felt fine.
I felt fine, and I didn't realize that I could feel this way, this lighthearted, this kind of pain-free and just like more lighter.
The cool thing, I'll get people with like reverse curves, lost curve in the neck, and I'll force their neck in a curve, and they'll go, because they can breathe easier. And I say, no, this is just normal.
Yes. So I think I've lost that feeling of normal, and I'm going back to actually feeling normal.
Honest to God, that's it. Yeah. Normal is cool. Yeah. Okay. At high energy, pain free. What could you tell someone that's stuck in that symptom, therapy? They're not addressing the cause.
try to find out what really the cause is, right? And like turn every stone you find until you find an answer. Before you do something where you can't go back, right? If you get the replacement hip, there's no way back. So
you can't undo surgery.
Yes.
Well said. Mm-hmm. Yeah, you guys are really cool.
You guys are really cool.
Yeah. So I mean,
the message I think is don't wait too long. Come down here, go through the testing. It is really simple. It is very easy. It's beautifully organized. It's a wonderful environment here, and it will open your eyes. And then you can always choose, how many treatments, how big, how far, how wide you want to go. Mm-hmm. And it's very flexible. So don't be afraid to just make the first step.
Mm-hmm. And I love it because we do multiple adjustments a day. So within 10 days, 2 weeks, we're getting post x-rays. Yes. So you can actually see the changes, not just feel them.
Mm-hmm. And I think that's the case with you.
I'm halfway there now. And very curious to see the x-rays. They were taken this morning. What? And I heard from the doctor they're good, but I haven't seen them yet. So I'm very curious.
My team was telling me, you got to see them. You got to see them. Yeah. So we'll probably do a short video on them later. Mm-hmm. But God bless you, man. Thank you. Because it takes courage to go in and present new ideas in a world that is just symptom drug oriented.
We're still trying to convince our families. So,
it's not that easy. We all know it's not that easy.
I have the best doctor. The hand goes up like a stop sign. I know. No. Take care of yourself. Because the world was made for you, you were made for the world, and your body only gives symptoms for a reason. And with 90% of the nerves having no pain fibers, don't wait for symptoms.
Yep. Mm-hmm. You don't have to wait for symptoms. You just go and do it for the next 50 years of your life.
God bless you.
For that.
I know you like each other. I know. I want to be married for forever, Sarah, because it's a blast.
That's why we have to be here.
God bless you all.
Thank you.